one of these things that was started back when President Adams was president, and this is a long time ago, in the 1790s, I believe. First hospital in the state was at Port Townsend and was moved to Seattle as part of the United States public health hospital system. During the Reagan administration, President Reagan wanted to end them, and his administration was very negative about the public health service hospitals. Working together on this, the county did things, the city did things, they had the Public Development Authority. It was just one of those really neat things that we do here in the Northwest, and I was proud to be involved.
This building is important to start with. It's a Depression era beautiful building that I don't know what the city would look like without it. I mean, it's just a beacon on the hill, on Beacon Hill. Starting back in 1933, I think, when the building opened, I think the services were basically hospital services for the indigent and for people who were owed care by the federal government, like the Merchant Marine, the Coast Guard, federal employees, public servants who could not afford, generally when they got older, the kind of care they needed. I really think the backbone of it were the employees up here at the hospital who, and not just the physicians who, it was a physician-governed hospital, but it was an effort by all of the people who worked here to save what they knew was an absolutely essential service.
I found in 2003, 2004, is that the organization was held together by an emotional commitment on the part of the employees to continue to do great work with one another, even though the operating environment was chaotic. And we didn't stay chaotic very long. We eliminated the chaos out of the day-to-day operations. And by 2004, 2005, the organization was no longer in catch-up. We were starting to rebuild ourselves from the core. And that's when we started to get our employees involved in how do we define our future and what do you want to do?
I felt PacMed was a really unique organization. I felt it the minute that I walked into the very first clinic, and I believe it was Madison. Harvey took me on a tour of the Madison clinic and introduced me to some of the employees. And I just felt this vibe in the clinic that was positive, friendly, warm. People were excited about their jobs. They were excited to be at Pacific Medical Center. And I really walked away thinking, wow, what a great, great organization. How unique and wonderful to see that in its employees.
PacMed, it's like a family to me. It's my second home. People here, they are amazing and to work with. The leadership, the staff, the ideas, the things, the new ideas that people come up with every day. It's just amazing.
What makes me excited and what drives me to work with Pacific Medical Centers is they allow me to be free to do the things that I want to do within their scope too, and that is get back out there, help as much as I can, try to bring as many people that I think want to enjoy this to help others and have everybody grow around me.
I think PacMed has raised the level of care, the quality of care that we provide patients. When you go to the Washington State website now to look at the level of quality of care for patients, we're one of the leaders.
I started here when it was a hospital. At that time it was the Marine Hospital, and then probably about a year and a half after I came here, it changed the names over to United States Public Health Service. And so I was able to meet a lot of military retirees. We also had active Coast Guard. We had Alaska Indians, Eskimos that came in. We had the American Indians that came from Montana, Nebraska, Wyoming. So it was a real pure joy to meet people from other states. and to take care of them, and some of them were in pretty bad shape when we got them in.
I love the idea of serving the underserved, which is part of our mission. And I love just the folks that, it's like it takes a different kinds of people that work at PacMed. And since we have a lot of long-term employees, we really know each other quite well. The providers and employees alike, they tend to love what they do, and I like being around them.
And my dream was when I was in little back home, I was always wants to go to school for nursing program, but my family was like they can't afford me to go to school. So that's why I said, oh, this opportunity came, so I took it. So now I still like, you know, in the future, if I decided I want to go back to school for nursing program, then can go. Especially like for PacMed, they offer us like tuition reimbursement for every year. We get like $1,000. So we can still like continuing our education, and they support us.
I came on the board in 1989, and Pacific Medical was a much different organization then than what it is now, but it was an attractive organization doing wonderful things for the community, and it was something that I felt that I could possibly contribute to, and that make it even more worthwhile. At that time, the organization only had 3 clinics, as opposed to what's 9 now. It's grown greatly over the years. Back in that day, we also had a cross-cultural center, which was pioneering in training doctors and providers to deal with people that couldn't speak the English language.
I started out in '91 as a contracted interpreter, and in 1996, PacMed hired me to work here full-time as a full-time medical interpreter. I love being an interpreter, you know, because I used to live in a refugee camp. I volunteer, you know, to help people in the refugee camp as a medical interpreter and interpret at school and stuff like that. So I love doing interpreting.
The focus is on the patient. What is the best way to serve the patients that come into the PacMed clinics? If you start from there and you go back from that, then the way the whole system works becomes much more efficient and much more friendly to the patients.
One of the things that originally stood out to me when I first started was that they had a patient assistance program that was, at the time it's called charity care. And a lot of people would come in and they would not be able to pay for services, but they'd get referred in and they'd get everything that they needed, from just a basic visit to have a diabetic foot check to cancer treatment. And a lot of companies don't operate that way. I think that they're really fair and consistent in how they do it. And when the economy took a downturn, our leadership team asked for feedback from us as employees. How can we help our patients? How can we walk them through this? A fund was established to help people who didn't meet the criteria for the regular patient assistance program, but it was another program they created to help those people. That's a company that cares.
What a champion does, they're very involved in the community. We are hoping to build a healthier community. We are hoping to raise awareness in the community, diabetes, education. We want people to know that they have choices. A lot of people don't go to the doctor because they're not aware of what's out there for them.
PacMed is a company that embraces change. One that comes to mind is our Versus system up at Totem Lake and Canyon Park clinics. The patients check in and they get this badge, and we get to follow them and track them through the clinic. It actually helps the MAs spend more time on prepping their visit, and it just results in just a better quality visit for the patient.
Project Access is a conceptual framework that's a national model, and when we tried to bring it to Seattle, PacMed was one of the only organizations that saw the logic in the model and was willing to engage with us as we learned whether or not this would work. The benefit to the community is both in dollars and cents and in patient stories. So in 2013, Project Access Northwest, through the generosity of systems like PacMed and our other partners and the 1,260 specialists, provided over $18 million in donated care to this patient population. So that's, for those that like stats, that's really, really cool. For those that want the patient story, we get to help people go back to work. We get to help folks return to a useful life. One of the patients we sent to PacMed got a corneal transplant at PacMed. We got the lens donated, the surgeon donated his time. That guy got to see his 4-year-old kid for the first time. He was 34 years old. That's the power of what a Project Access can do in partnership with somebody like PacMed.
We talk at Pacific Medical Center a lot about what makes a good doctor, and I think there are some things that haven't changed at all and some things that have changed. The thing that is really constant is this is an ability for the doctor to gain trust with the patient. And there are many ways you do that, but most importantly, you're listening to the patient. You're letting the patient know that you care about the problem that they have. And when you gain that trust, they will take your advice seriously. And in that way, they'll get better.
I love PacMed. They are just wonderful. In the day after Thanksgiving in 2012, I got a phone call from Dr. Ludwig, my primary care, and he told me that I had cancer. And I'd gone in about a week before that, well, a little less than a week before that, a few days before Thanksgiving, because I had a lesion on my breast. And Dr. Ludwig looked at it, and then he right then said, I want someone else to look at this. And he called in the dermatologist who was here. And he looked at it and he said, I think I want to do a biopsy. So I went to the other waiting room and they came out and got me immediately. And he did the biopsy, and that's why they knew what I had. So from the moment I became in Dr. Ludwig's care until today, and it's still going on because I'm not finished with treatment, they've done everything for me. I have not had to make an appointment or do anything at all. All I do is listen to what they have to say and show up. And they take care of me, and I'm doing great.
You can never really know what has gone on in that person's life that day, that last week, or as a child, that makes them act the way that they do. And to try and just learn and be patient and listen, it's been a really amazing life lesson for me.
One of my best days, actually, is when a patient will come back and say, thank you, or God bless you, or, you've really helped me and my family. That means a lot.
I think PacMed in the future needs not to forget its past and its legacy, basically, which has been a provider that would take care of people from multi-ethnic groups from all over the world who have just come to this country, who have really different needs than the average person. I think as medicine becomes more homogenized and groups get bigger and bigger and bigger, that legacy can be lost. And I think it's important to maintain it, and it's important to nurture it and to treasure it.
Right now, what we're doing is we're consolidating the efforts of the last decade. And we're putting it into a position where people who are in this organization today are going to take it to the next level. And we're turning over the power for those future opportunities to them.
Now Harvey's taken it to a new, higher level, and I think this new idea of joining with Providence is going to be a great for the future of this organization, and I'm proud to have supported it. I think that A lot of good things have happened.
This place is needed. The clinic is certainly needed. And the power of partnership with Providence coming up now, which I think sounds like a really good idea. You have to figure out, how do we fit in a changed environment? What do we have to do going forward to keep this place viable and a provider of health services?
Pacific Medical Center has been given an opportunity to write the next chapter for our company. And who's going to write that chapter? You are.